What if your body has already been trying to warn you about diabetes, not in a lab, not in a doctor's office, but right there on your feet every single day, and you just didn't know what you were looking at? That's not a dramatic question. That's the reality for millions of people right now. Most of us have been taught that diabetes is something you find out about from a blood test. You go in, the doctor calls you back, the numbers are bad, and that's the moment everything changes. But what if I told you that your body starts sending signals months, sometimes years, before that blood test ever happens? And what if those signals are sitting right at the bottom of your legs? Completely visible, completely real, and almost completely ignored. Today, that changes. What you're about to learn could genuinely alter the way you think about your health forever. My name is Dr. Richard Ben, and I've been practicing medicine for over 20 years. In that time, I've sat across from thousands of patients, and I've noticed a pattern that never stops being heartbreaking. People come into my office, good people, careful people, people who care about their health, and they've been living with warning signs for 1 year, 2 years, sometimes longer. They explain those signs away. They told themselves it was age or the weather or bad shoes or just tiredness. And nobody ever sat them down and said, look, your body has been talking to you. Here's what it's been saying. That's exactly what this video is. It's that conversation. The one that should have happened sooner, but it's happening now, and now is what matters. Just last month, I had a patient come in for a routine checkup. 67 years old, retired, felt fine by all accounts. Before we did a single blood draw, I sat with him and asked him about his feet. He laughed a little and said his feet had been numb for a while, but he figured that was just part of getting older. We talked for a few more minutes, and by the time the conversation was done, I had identified 4 separate warning signs. 4 things his body had been doing for a long time that nobody had ever connected to blood sugar. His fasting glucose came back at 214. He had been diabetic for over 2 years without ever knowing it. That man is not unusual. The American Diabetes Association estimates that 1 in 5 Americans with diabetes don't know they have it. That's more than 8 million people walking around right now, living their lives while high blood sugar quietly damages their nerves, their kidneys, their eyes, and their feet. So let's talk about the first sign, and I want you to think carefully about whether this sounds familiar, because almost every patient I've ever had has experienced this and explained it away without a second thought. Tingling, numbness, that pins and needles feeling in your feet. People tell me all the time, Dr. Ben, my foot just falls asleep. I was sitting with my legs crossed. And yes, that happens to everyone once in a while. That's completely normal. But here's the question I always ask. Is it happening regularly? Without a clear reason. Because frequent, recurring tingling or numbness in the feet is one of the earliest signs that blood sugar has been elevated for some time. Doctors call it peripheral neuropathy, and it happens because excess sugar in the bloodstream slowly attacks the protective coating around your nerves. Think of your nerves like electrical wires wrapped in plastic insulation. When blood sugar stays high, it's like a slow-acting acid eating through that coating. The wire still functions for a while, but the signals get fuzzy. And that fuzziness, that's the tingling you feel. According to the American Diabetes Association, peripheral neuropathy affects nearly 50% of people with diabetes, and it almost always starts in the feet. Tens of millions of people are dismissing this feeling right now. My recommendation, start a 20 to 30-minute walk every single day and start cutting added sugar out of your diet. Not next month, today. Now here's sign number 2. And this one is particularly cruel because it doesn't bother people during the day when they're busy and distracted. It waits until they're lying in bed trying to sleep, and then it hits. Burning. A deep, relentless burning in the soles of the feet. Patients tell me it feels like their feet are on fire, and they've assumed it's from standing too long, or the heat outside, or just worn out muscles. But when someone describes burning foot pain that gets worse at night when they're completely at rest, I take that very seriously. Here's what's actually happening. The nerves in your feet have been damaged by excess sugar, and now they're sending incorrect signals to your brain. Your brain receives a message that says heat, but nothing hot is touching your foot. The nerves are misfiring, like a faulty fire alarm going off in a building that isn't burning. The sensor is broken, so the alarm keeps screaming. Your nervous system is doing the same thing. That burning sensation is nerve tissue in distress, sending out a cry for help that most people silence with a fan or a cold cloth instead of recognizing it for what it is. Research published in the journal Diabetes Care found that burning foot pain is one of the first symptoms reported by patients later diagnosed with type 2 diabetes, often appearing 1 to 3 years before any formal diagnosis. Drink at least 8 glasses of water a day and add more fiber to your meals. Both of those habits help manage blood sugar and support the nerves that are under attack. Sign number 3 is where things stop being just uncomfortable and start becoming genuinely dangerous, and I need you to hear this clearly. A wound on your foot that won't heal. Not a dramatic injury, just a small blister from a shoe. A tiny cut. A little scrape. Most people wait weeks before mentioning it, because most small wounds heal on their own. But not when blood sugar is high. When glucose stays elevated over time, your body loses its ability to heal efficiently. The tiny blood vessels in your feet begin to narrow and stiffen, which means that the oxygen, the white blood cells, and the nutrients your body uses to repair tissue simply cannot reach the wound fast enough. The wound just sits there, open and vulnerable. Imagine trying to water a garden through a hose with a serious kink in it. The water exists, it just can't get where it needs to go. That's exactly what high blood sugar does to circulation in your feet. And an open wound that won't close is an infection waiting to happen. The Centers for Disease Control reports that diabetic foot ulcers are the leading cause of non-traumatic lower limb amputations in the United States, over 100,000 per year. Almost every single one of those cases started with a small wound that was ignored. Tonight, after your shower, sit down and carefully examine both feet. Look between every toe. Look at your heels. If you see anything that shouldn't be there, clean it, cover it, and if it hasn't improved in 48 hours, call your doctor. Not next week. 48 hours. Sign number 4 is hiding in plain sight, and most people have looked right at it hundreds of times without ever understanding what it meant. Discoloration around the ankles. Skin that looks darker than it should or has a reddish or even slightly bluish tint. Patients explain it away as sun damage or just their natural skin tone, and sometimes that's true. But there's a specific pattern of color change around the ankles that I look for when I'm assessing blood sugar risk, and it's something you can see with your own eyes. When circulation is compromised by high blood sugar, the lower legs and feet don't receive enough fresh, oxygenated blood. The skin responds to that shortage by changing color. It may darken, redden, or take on a dusky tone around the ankles, and in some patients the skin in that area also becomes thinner and more fragile, a sign that the tissue isn't being properly nourished. I always tell my patients to think of their blood like a delivery truck, carrying oxygen and nutrients to every part of the body. Your feet are at the end of the longest delivery route, farther from the heart than anywhere else. When the roads narrow because of damaged blood vessels, the deliveries stop arriving on time. The skin, starved of fresh oxygen, changes color. It's a distress signal your body is painting on the outside of itself, and a study in the Journal of the American Academy of Dermatology found that these changes appear on average 18 months before a formal diabetes diagnosis. 5 minutes of ankle circles and calf raises every single morning, even that small amount of movement, pushes fresh blood down into your feet. Sign number 5 surprises people because it looks so innocent. Severely cracked heels. Skin on the heels so dry and split that no lotion seems to make a lasting difference. Almost every patient tells me, Dr. Ben, I've always had dry heels, It's just worse in winter. But when heels are cracking badly in the middle of summer, or when you've been moisturizing faithfully for months and nothing helps, that's a fundamentally different situation. Diabetes damages the autonomic nerves, the ones that handle automatic functions your body manages without any conscious effort. One of those functions is regulating moisture in the skin of your feet. When these nerves are damaged, the sweat glands in your feet stop working correctly. Your skin loses its natural moisture from the inside out, and no cream in the world can fix that root problem. Think of your skin like a wall held together by mortar. When those autonomic nerves fail, the mortar crumbles and the wall develops cracks. And those cracks in the skin of your heel are not just cosmetic inconveniences, they are open entry points for bacteria, especially dangerous in a foot with already compromised circulation. The American Podiatric Medical Association identifies chronic, hard to treat heel cracking as a significant indicator of autonomic neuropathy in seniors, a condition directly linked to long-term elevated blood sugar. Moisturize your feet every night before bed. Coconut oil or a rich foot cream on the sole and heel, but never between the toes, because trapped moisture there breeds fungal infection. Sign number 6 involves swelling. And while puffy feet at the end of a long day are common, what I'm describing here is something different. Consistent, persistent swelling in the feet and ankles. Deep sock marks every evening. Swelling that doesn't fully go away overnight. This happens because high blood sugar damages the kidneys, and the kidneys are responsible for managing your body's fluid balance. When that filtration system is under stress, fluid accumulates and gravity pulls it to the lowest point, your feet and ankles. Press your finger into the swollen area and the indentation stays there for a moment. That's called pitting edema, and it means your body's drainage system is struggling. The National Kidney Foundation reports that diabetic kidney disease affects approximately 1 in 3 adults with diabetes, and lower extremity edema is frequently the first visible sign that something is wrong with kidney function. Elevate your feet when resting, and reduce sodium in your diet. Salt causes your body to hold on to water and makes swelling dramatically worse. If the swelling is new or getting progressively worse, bring it to your doctor's attention soon. Sign number 7 is the one I see most commonly misdiagnosed, especially in men. Stabbing, electric, sharp pain in the feet, most often at night. Patient after patient has told me they've been taking ibuprofen for months thinking it's arthritis or an old injury acting up. And sometimes that's exactly right. But sometimes the pain has a completely different origin. When nerves are damaged by chronic high blood sugar, they don't always go quiet. Sometimes they become hyperactive. They fire random, intense signals that your brain interprets as severe pain. Stabbing, burning, like a hot needle. And the reason it's worst at night is because during the day, other sensations and distractions compete for your brain's attention. At night, there's nothing else. Just the misfiring alarm of a damaged nerve screaming for no external reason. A landmark study published in the New England Journal of Medicine found that painful diabetic neuropathy affects approximately 25% of people with diabetes and is routinely mistaken for arthritis or age-related joint pain. Ibuprofen doesn't fix a damaged nerve, it just silences the signal your body is desperately trying to send you. Every morning, before you get out of bed, spend 5 minutes gently flexing your feet and circling your ankles. Get blood moving before you put weight down. Every night, give your feet a gentle massage, light, circular strokes along the sole and up toward the ankle. Sign number 8 tells me how far things have progressed, and when I see it, I know this is not an early situation anymore. Persistently cold feet, cold in July, cold under 3 blankets, cold even when the rest of your body feels warm. Almost every patient says the same thing. I've always had cold feet, Dr. Ben. It's just my nature. And I listen. Then I ask, are they cold in the summer? Are they cold under a pile of blankets at night? Because that's when I'm concerned. When blood vessels have narrowed or stiffened significantly due to long-term blood sugar damage, warm blood simply cannot reach the extremities in sufficient volume. Think of your circulatory system like a heating system running pipes through your entire house. When those pipes narrow, the heat doesn't make it to the farthest rooms no matter how hard the furnace works. The room stays cold. That's not about weather, it's about pipes. The American Heart Association identifies peripheral artery disease as affecting over 8 million Americans, with diabetes being the single largest risk factor, and persistent cold feet are one of its earliest and most consistent symptoms. A 30-minute brisk walk every day, not a casual stroll but a purposeful arm-swinging walk, forces circulation into the lower legs and feet, and over time can begin to reverse some of that early narrowing. Sign number 9 is the one almost no one talks about. Not in patient brochures, not in waiting rooms, not in most doctors' offices unless they're specifically looking for it. Hair loss on the lower legs and the tops of the feet. Not all hair, everywhere, specifically in those areas. Most patients look down when I point it out and say, I genuinely never noticed that. And that's exactly the problem. Hair follicles need a constant, steady supply of blood and oxygen to function. When circulation is significantly impaired over a long period of time, the follicles in the feet and lower legs slowly stop receiving what they need, and eventually they stop producing hair altogether. Think of those follicles like small plants in a garden. When the irrigation system narrows or blocks, the plants don't die dramatically, they just quietly stop growing. The absence of growth is the message. Research published in the journal Diabetes, Obesity and Metabolism found that hair loss on the lower extremities correlates significantly with peripheral vascular disease in diabetic patients. It's a reliable, frequently overlooked sign that physicians are specifically trained to look for during foot exams. After this video, look at your lower legs and the tops of your feet. If the hair is noticeably thinner than the rest of your leg, or absent entirely, schedule a blood glucose test this week. Not this month, this week. It costs around $12 at a certified lab, and for most people over 65, it's covered by Medicare. We've been through 9 signs today, 9 things your body may already be doing right now. 9 chances to catch something before it becomes something much harder to manage. And I want to be honest with you about something, because you deserve honesty. The hardest part of my job isn't delivering a difficult diagnosis. The hardest part is sitting with someone who has had every single one of these signs for 2 years and watching the look on their face when they realize they could have known sooner. These people are not careless. They are not irresponsible. They just never had this information. You now have it. So here's the one thing I'm asking you to do tonight, just one thing. Before you go to bed, sit down and look at your feet. 30 seconds. Look at the skin. Check for any wound that shouldn't be there. Notice whether anything feels numb, burning, or unusually cold. That's it. 30 seconds. And if anything on this list sounds familiar, call your doctor tomorrow. Not next week. Tomorrow. Because the earlier this is caught, the more completely it can be managed, often through nothing more dramatic than a change in diet, a daily walk, and one honest conversation with a doctor. You've worked hard for the life and the health you have. Don't let something as manageable as blood sugar take any of that from you just because nobody told you what to look for. Now you know. Share this with someone you love, because you might be giving them something they didn't even know they needed. I'm Dr. Richard Ben. Take care of those feet. I'll see you in the next video.